Hello guys, in this video we're going to be talking about MI, which is myocardial infarction. For short we call it MI. So we're going to be looking at the definition of MI, what is myocardial infarction. So the myocardial infarction is commonly known as a heart attack. It's also called heart attack. Occur when the blood flows to the part of the heart is blocked. So whenever the blood flowing to the part of the heart is blocked, and it leads to damage or death of the heart muscle due to lack of oxygen. So it's called MI or myocardial infarction, right? So in this myocardial infarctions, the oxygen demand will be lesser than the oxygen supply, right? So that's the definition of myocardial infarction. We know that the coronary artery is the one responsible to carry blood to the heart muscle. So when there's an obstruction within the coronary arteries, the oxygen flowing or the blood flowing to the part of the heart will get limited, and the heart will start getting lack of oxygen, lack of nutrients, and the heart tissue will begin to die gradually. So in this diagram, as you see here, there's a plot, a buildup of a plot within the coronary arteries that limiting the flow of the blood to the myocardium, that are causing heart attack, or that also causing what we call the death of the tissue of the heart. So causes of myocardial infarctions. So there are major causes of myocardial infarctions. In one of our videos, we talk about thrombolysis. And thrombolysis is a formulation of a blood clot within the coronary arteries. So what happens in thrombolysis is that when other fats, other cholesterol get broke down within the body and then move through the wall of the arteries, those fats and cholesterols, let's say crumbs, are much bigger that cannot pass through the wall of the artery easily, or the coronary artery easily. So it's going to cause a blockage within the coronary arteries that are going to lead to what we call less oxygen supply to the myocardium, that's going to obstruct the flow of our blood and going to cause the death of the heart muscle. We have to also talk about clot build up. So there are other factors that leads to clot building up within the coronary arteries. And once there's a clot build up within the coronary arteries, they're going to narrow the flow of the blood to the coronary arteries, to the myocardium, and it's going to cause tissue death of the heart. So here, this is a pictorial diagram of an arteries. These are all coronary arteries. As we told you from the initial stage, that coronary arteries, they are responsible to carry blood to the myocardium, meaning to the heart muscle. So here you see there's a plot built up here. So we're going to take a series of videos that we're going to talk about the mechanism of action. How do the plot get built up within the coronary arteries? So this is a plot. As you see here, the plot is building up within the coronary artery. Eventually the clot will begin to get big and bigger. Now when you have a rupture of the clot or the plot that is built up within the coronary artery, the body immediately responds to the clot. So when the body responds, then there can be an additional plot or clot built up on the plot. Here is going to cause the flow of the blood to be stopped completely. The blood will no longer flow to the myocardium. So therefore the heart tissue is going to die. So we talk about diagnosis of MI. So there are different factors, different chemicals doctors can order to diagnose MI. But for this video, we're going to be looking at the ECG lead, right? Now we're going to be looking at the ECG, the electrocardiogram. So there are two major types of MI. The two major types are ST elevations of myocardial infarctions or non-ST elevations of myocardial infarction. So, but what is the difference between the two? So the ECG lead is going to clearly identify, going to tell you as to whether this is an ST elevations of myocardial infarctions or it's a non-elevations of myocardial infarctions. So in the ST elevation of myocardial infarctions, there is a total blockage of the coronary arteries. So the coronary arteries is going to get blocked completely. Means that there will be no flow of blood to the myocardium. Right? So the entire tissue is going to die. So again, notice that on the ECG graph with an elevation of the ST segment. So let's see the ECG graph. So this is the ECG graph. In the ECG, there's a normal ECG graph. You get a P wave, the Q wave, the R wave, the S, and the T wave. So here in the P wave is where you see the depolarization begins. From the T wave, you see the QRS complex, and then you see the ST segment. Then from the T segment to another segment is going to be the P segment. So the depolarization begins with the P wave and repolarization begins with the T wave. There will be a video where we have to talk about what happens in each of these segments. But today we're looking at MR. So if you look here in this other diagram, you're going to look at, we say ST elevation. Now, if you see the basement of the normal ECG lead here, you're going to see here at this basement, there's an elevation of the ST segment. Remember, we said from this point to this point is called the ST segment. So when you order for an ECG for the particular patient that have MR, when the ECG present in this way, where you see there's an elevation here of the ST segment, is an indication of ST elevations of myocardial infarction. As we said, ST elevation of myocardial infarction is a complete blockage of the coronary arteries that take blood to the myocardium is completely blocked. Means there is no flow of blood anymore to the myocardium. So we look at non-ST elevations of myocardial infarctions. The non-ST elevations of myocardial infarctions, there is no total blockage of the coronary arteries. There are still passage of blood through the coronary arteries, but at that stage is limited. So let's see the representation on an ECG graph. So if you as a physician order for ECG for the patient that presenting the symptoms of MR, once the ECG presents like this, as we talk about the P and the QR segment, you talk about the QST segment, right? But here, if you see the ST segment of this graph, you have depression. Means that the ST segment is moving downward. There's a depression of the ST segment. So therefore, it's a clear indication of what we call non-ST myocardial infarction. So the non-ST myocardial infarctions is a non-block, is not a total blockage of the coronary arteries. There is a blood flow through the coronary arteries, but there's a limited blood flow through the coronary arteries. So there's a difference between the ST elevations of MR and non-ST elevation of MR. So let's look at risk factors. What are the risk factors associated with MR? So one risk factor is hypertension, meaning high blood pressure. That is one major risk factor. So patients that have high blood pressure stands a high rate of getting what we call MR, because It is fats, cholesterol, and other clot of blood clot within the body breaks down and move through the wall of the artery. And once a patient is diagnosed of hypertension, there is a possibility that when the BP or the blood pressure push or pump harder, these clots and cholesterol will move through the wall of the artery and will cause MI. That's one. Two, high cholesterol level. We already talked about that. When the cholesterol is high, there's a possibility it will move through the coronary arteries. Patients that smoke or smoking patients, diabetic patients, obesity patients, lifestyle, family history disease. So these are all major factors of MI. So we talk about clinical manifestation. Means if the patient presents with MI, what are some of the signs as you physician is going to see within this patient? We want to talk about chest pain. The patient will present with chest pain and discomfort in the chest. The chest pain varies per gender. In a male, you will have severe chest pain, but within a female, the chest pain will not be as severe as compared to the male, but the female will present with other signs and symptoms. So we talk about pain radiation. That will be another sign and symptom of the patient. The patient will have what we call pain radiation, or pain radiating from the jabs to the neck to the left arm up to the back. Then we'll also talk about shortness of breath, SOB. Yes, the patient has to present with shortness of breath because there is less oxygen supply to the heart. So when the oxygen is less, the patient will not breathe correctly. So we have SOB. So these are signs and symptoms of ST elevations of myocardial infarctions, right? So we get pain around the shoulder, right arm, chest. So we talk about pain radiations. You see the patient having nausea or vomiting. You see the patient having discomfort or tiredness, right? So these are major signs and symptoms that you will check for in an MI patient. So let's look at case study. There's a patient that came to our emergency department at the age of 58 years and presented on the cardiology department with chest pain with the left arm associated with vomiting and dizziness, and the pain begins 2 hours prior and have not resolved at rest. So we also check for a patient's past medical history, what the patient has been involved with, or what are some conditions the patients were presented with before coming to our facility. You say the patient have a history of hypertension. So the patient has been a hypertension patient. Like in our risk factors, we told you that the patient have high blood pressure stand the risk of MI. So the patient has been on amlodipine 5 mg once daily. So we order for the ECG. In the ECG interpretation says that there was an elevation in lead 2, 3, and AVF, consistent with an inferior wall myocardial infarction. So this alone tells us that the patient has what we call ST elevations of MI. But again, we also check the other side to see in the reciprocal, the ST segment depression is not in the lead 1 and AVL. So I will take time to explain what are the different reading of the ECG. So the patient is not a non-ST elevations of myocardial infarctions, but the patient is at ST elevations of myocardial infarctions based on the ECG reading. So we'll talk to the patient about some lifestyle modification. The patient is a smoker with a 30-pack year experience and occasionally consume alcohol, no history of illicit drugs. So there was the ECG lead that we got from the cardiology department, and we look at it. They talk about elevations. You see, there's an elevation here in lead 3 in AVF. You also see elevation in AVF, right? So this ECG lead give us the clear demonstration that yes, this patient is ST elevations of MR. So thank you ever so much. Please follow us on YouTube. We have our YouTube channel. It's also called Dr. Dennis. You can check for us. And until then, we say bye-bye and bye-bye for now. Thank you.